pretty voice. There we go. I even put a little sticky note so I didn't forget to record. All right. Well, thank you guys for being on today. We are on our third, I can't even believe it. Is that right? 3, our learning session and practice coaching calls. So we have a packed agenda today. So we are just going to real quick go around like we did last time and do introductions. And then we're going to we have a recorded presentation from Dr. Lisa Vaughn. She's a researcher out of Cincinnati Children's. We worked on an HPV project with her prior to launching our HPV-QI project. And so we're just going to give you guys an update on the research and what we found, and maybe we'll find it useful kind of moving forward. Then I'll turn it over to our favorite Zainab, who's going to be doing a data presentation. And then we have Dr. St. Clair with Blue Ridge Pediatrics is going to do a PDSA report out. We're going to have a quick goal discussion, and then we'll just kind of breeze over some reminders and next steps. And I see there's a couple chats in here. Karen. Oh, can't hear. Okay. Can you guys hear us now?
It doesn't sound like they can hear us now, but hopefully they're seeing my responses.
Yeah. Okay. Well, we'll move forward, but if we need to figure something out, and there's always a call-in number too. So we can always post that. I don't know if anyone's able to get to the calendar request and copy that. I can't log out because I'm sharing my screen. But if anybody can find that and post it.
I'll do that in a minute. I'm responding to the chat.
Okay. Okay. So real quick, we'll just go through welcome and introductions. Again, if we can have someone from each team kind of introduce themselves and just let us know who's on, and then answer our fun icebreaker question. Our icebreaker question today is, what is your favorite summer activity other than sweating? I think that's my favorite so far this summer, is just sweating profusely in the humidity. But if we can, Dr. Crick, while you're on, I can't tell if Dr. Karras is on. I think he is. So if one of you wants to go and introduce yourselves and tell us your favorite summertime activity.
Do we go to, because I can go first.
Yeah, Zainab, feel free.
Okay. So I'm Zainab. I do a lot of the data analysis of the data that you guys send us. And I also create the graphs that we share with you as well. I know I received an email from a few of you regarding some of the data. Please feel free to either, see what my email is in the emails that Lori sends, or just ask Lori for my email. I can share that, and just feel free to email me if you have any questions regarding the graphs that we shared today, or anything in terms of data collection. Please feel free to contact me. And my favorite summertime activity is, actually, I do not like the summer. It's very hot and I get very irritable when it's hot, but I do love ice cream. So I know you had a little picture of popsicles on there. So, but I eat ice cream even in the winter. So I guess just a little extra in the summer. So
I like your style.
Yeah, thanks.
Then we have Dr. Crick and Dr. Karras both on. We know you've met them in previous meetings, but thank you guys both for being on. And we'll turn it over to OSU. And I know I saw at least one person on there. I think who did I see?
Yeah, this is Nezzy Tajshal. I'm
right,
on, and I think Dr. Jingjing Mao's on as well. She's
Perfect.
from the Grandview practice. I love gardening in the summer.
Perfect. Do you grow vegetables?
Both vegetables and flowers. Yep.
That's awesome.
So the vegetables have to be at a community garden because the deer and rabbits take care of them otherwise.
Yeah. Well, awesome. Thank you guys for being on. And then do we have anyone from Nationwide Children's Hospital, the Pediatric and Adolescent Gynecology Group? I don't know if we have anybody on from that. And what about the Center for Colorectal and Pelvic Reconstruction? Okay, we'll move on. Do we have Hilliard Pediatrics on? Dr. Lucine?
Hi, I'm here. Trisha Lucine here. My favorite summer activity is probably sitting on a patio listening to music with a cold beverage.
That sounds amazing. I'm hoping to do that this weekend.
Yes, it's going to be beautiful.
And I see that Natalie is on from PAG. If you want to say hello and tell us your favorite summertime activity.
Sorry, I was in an elevator. I was like, oh no, I'm going to lose you all. My favorite summertime activity is a beach vacation with my kiddos.
That sounds nice too. My sister's there now and actually had a shark encounter yesterday.
Oh, yikes. We had some stingray encounters last week. So,
it's fun, but also scary. Maybe that makes it more fun. Who knows?
yes.
All right. In the school-based health centers, I know Meg is on.
Yeah, hi. I, similar to Dr. Tushall, I also enjoy gardening in the summer, but unlike Dr. Tushall, I cannot grow flowers to save my life. So I only grow vegetables and once in a while a fruit of some kind. So that's what I do in the summer. And the other thing I do is complain. I like to complain in the summer about how short the summer is because I really like hot weather.
Oh, I complained because of the hot weather. So
no, it's so
I
great.
hate the hot weather.
Oh, I love it so much. I want my bones to be hot.
Oh my God. All right, Blue Ridge Pediatrics.
Hey, Scott St. Clair here from Blue Ridge Pediatrics. Also got Sarah Townsend, my vaccine coordinator here. And we love hiking in the mountains of Western North Carolina. So beautiful time of year to get out and do that.
That sounds nice. And Augusta Pediatrics, I'm not sure. I know Dr. Drake was going to be a little late, so I'm not sure if anybody has joined or not.
Yeah, I'm Kathy Williamson, the practice manager. So
perfect.
Dr. Drake will be a few minutes late, but will be joining us soon. And my favorite thing to do in the summer is go to the beach.
I love it. Hopefully we all get a little trip before the summer ends. All right. Well, thank you guys so much. I am going to go ahead. The recorded webinar or presentation is next. So I'm going to ask right when it starts, if you have any issues hearing it or seeing anything, or if anything's delayed, please let me know. But I'm going to go ahead and just play that for you.
Hello, everybody. I'm Lisa Vaughn, and along with one of my former PhD students, now Dr. Nair, have been working with Ohio AAP since about 2018 to increase HPV vaccine uptake across Ohio. Today, I'll share some of the results of our work together over the last several years. As you already know, human papillomavirus is the most common sexually transmitted infection in the United States and is responsible for over 35,000 cases of related cancers every year. HPV and the related cancers can be reduced through prevention by widespread uptake of the HPV vaccine, and the U.S. is working toward a goal of an 80% vaccination rate across the board. However, uptake is uneven across various demographics. In Ohio, the HPV vaccine rates are improving, but we still have work to do. The overall purpose of our work on the HPV vaccine has been to better understand parent, youth, and young adult perceptions of the HPV vaccination and to explore barriers to HPV vaccine uptake in Ohio. We've had 3 phases of work together. Phase 1 was parent and youth, young adult pulse interviews and the creation of personas, which I will explain a little bit later. Phase 2 was provider interviews, and which really served as the validation of the personas. And then phase 3 was a handful of parent interviews that we had hoped to expand, but due to some of the constraints during COVID, we decided to halt on those parent interviews. Today, I'll mainly focus on phase 1 results. To access a variety of parents or caregivers and youth and young adults, We recruited participants at a mixture of local community events and health fairs, festivals, and church and neighborhood group meetings around the state of Ohio. Throughout winter and spring 2019, potential participants were approached at these events by research team members, given the details of the study, screened for inclusion criteria, and asked to verbally consent before participating in the pulse interviews. Parents and caregivers who identified as the medical decision maker for a child between 8 and 18 living at home and youth and young adults 10 to 24 were considered to be eligible for the study. We used a technique called pulse interviewing to talk with parents and caregivers and youth and young adults in these public settings. Pulse interviews are short conversational interviews that are tightly focused around a specific topic. We've had great success using pulse interviews in a variety of community-based studies. Pulse interviews occur within a brief period of 15 to 20 minutes or less and can provide a unique blend of descriptive and narrative data in a short amount of time. We use 3 semi-structured pulse interview guides, one for parents and caregivers, one focused on youth and young adults ages 10 to 24, and then the third interview guide was for folks, both parents, caregivers, or youth, young adults who had never heard of the HPV vaccine, which we ask about during the screening. These interview guides were developed by a team of pediatric and research specialists, and they were designed to explore knowledge, attitudes, beliefs, and practices related to the HPV vaccine. The parent, caregiver, and youth, young adult interview guides contain questions about who should get the vaccine and when, where participants get vaccine information, and their preferences around where the vaccine information should come from, as well as what motivates them or keeps them from choosing the vaccine for their child in the parent caregiver interviews. 270 participants were interviewed across these 3 groups. Results were clustered into 4 general domains related to the HPV vaccine: knowledge and familiarity, beliefs, vaccine-related behaviors, and messaging and communication preferences about the HPV vaccine. We used a thematic analysis approach to analyze the results of the pulse interviews. The themes were categorized in these 4 domains. In terms of knowledge and familiarity, all of the respondents were very knowledgeable about the HPV vaccine and what it does. They understood that HPV is a sexually transmitted disease and can lead to genital warts and cervical cancer. Most participants had a clear idea of the age range for vaccination. They were less knowledgeable, however, about the link between HPV and head, neck, and throat cancer and the maximum age to which the vaccine can be received. In terms of beliefs, nearly all of the respondents believe that the HPV vaccine is important and cited that keeping children safe and cancer prevention were excellent reasons to get the vaccine. Just over half of the youth, young adults, and parents caregivers reported that they are not at all worried about getting the HPV vaccine. Fear was the most common response associated with getting the HPV vaccine for youth and adult respondents who did report worries. Youth respondents were concerned about shot pain at the time of vaccination. And parents and caregivers never mentioned the shot pain, but were fearful of side effects associated with the HPV vaccine. A number of parents and caregivers said they needed more information and data to be informed about the HPV vaccine to alleviate their fears. And then for some respondents, skepticism and distrust of research and the medical system in general were also mentioned as underlying fears related to getting the HPV vaccine. In terms of behaviors, the reported uptake of the HPV vaccine was high. More than half of the parents and caregivers and 2/3 of the youth young adults reported that they had completed the series, were in the process, or would start within a year or two due to their age. Nearly all parents and youth young adults reported that the information on HPV and the HPV vaccine came from a direct conversation with their doctor or from printed information in the doctor's office. Only a small number of families said that information on the internet and television commercials were sources of the HPV vaccine education. Around a quarter of the youth reported getting HPV vaccine information from their schools. In terms of preferences for messaging, parents and caregivers indicated that they wanted more information on the risks and the ability to be certain of the efficacy and safety of the HPV vaccine. They said that their doctor's endorsement would be the most effective at convincing them to have their child vaccinated. Youth most often referred to the need to educate parents about the vaccine, and they in fact said that many times they would tell their parents that they wanted to get the vaccine, and in some cases the youth or young adult was in favor of the vaccine, but it was the parents who were against it. A small group of parents indicated that there is no information or message that would be effective at changing their minds about their children receiving the HPV vaccine. Many parents and caregivers treated the HPV vaccine as a routine part of medical care, but offered little to no extra explanation of the cancer risk or how HPV is spread, while other parents opted to share more with their children. Based on the identified patterns within the domains that I just described, we created personas. Personas come from the human-centered design world. My understanding is they were originally used with software end users, recognizing that not all users on the computer look the same. Personas are fictional portraits with visual and narrative descriptions that represent a composite archetype of a group of end users who share similar goals, motivations, and behaviors. We used Nielsen's 10-step process for creating personas, and we charted descriptive findings alongside the qualitative themes from the Pulse interviews. These common patterns resulted in the personas that I'm getting ready to share with you. I think it's important to mention that the final personas are composite archetypes or portraits that incorporate data from all participants. So in other words, the individual participants do not match one-to-one with each persona. Here you see a diagram that details the process of developing the HPV vaccine personas. The Pulse interviews with the three groups that I mentioned, parents and caregivers, youth and young adults, and those who had never heard of the HPV vaccine. The 4 categories or domains of the thematic analysis and the main patterns there. These were combined with the response rates and the thematic analysis. And then together, this resulted in 5 personas that I'll describe in just a moment. As I mentioned, the personas are not meant to be a direct one-to-one descriptor of respondents, but rather represent a fictional composite of common patterns across the domains of knowledge, beliefs, behaviors, and preferences within and across respondents. We have provided a visual image for each persona, but race, age, etc. are not intended to be specifically representative of the data. Persona A is hesitant about receiving the HPV vaccine based on side effect fears, worries about the newness and perceived lack of research on the vaccine, or concerns about the promotion of sexual behavior in their children. Persona A is rational and knowledgeable about the vaccine. They trust their personal doctors, but may have concerns about big pharma or the broader medical research community. They may fear that making money may be more important to vaccine companies than safety, or that safety information is being hidden to help sell vaccines. Morality issues also play into the fear and lack of trust for this persona. Persona A wants to be the only source of information for their children about sex education and are closed off to messages about HPV and the HPV vaccine because of the association with sex. This persona is almost exclusively parent and caregiver. Youth mention far fewer misconceptions and consider the issues around sexuality, morality, and religion only in reference to their parents and their attitudes about the HPV vaccine and barriers to vaccination that parental attitudes create. Persona B has very strongly held views against vaccines in general, and no amount of conversation or facts is likely to change this point of view. Persona B believes healthcare and pharmaceutical industry and/or the government do not have patients' interest at heart and are solely looking to make money or to control people's health and well-being. Persona B's thinking is entrenched. The fear and misinformation associated with distrust is taken to an extreme level, in some cases to the level of conspiracy theories. The only possibility of persuasion about the HPV vaccine is if doctors say they would vaccinate their own children. However, Persona B is likely to seek care from like-minded physicians who are also against vaccines. Youth are not typically represented by this persona. Persona C is very focused on side effects and may have collected negative anecdotes from friends and relatives about the HPV vaccine. They may be more comfortable with other more established vaccines, but have a strong desire for more proof of the safety and efficacy of the HPV vaccine. Honesty and trustworthiness are a big emphasis for this persona. For some, no amount of data or information will be enough to change their minds, but most remain open to change and want to be convinced. Little to no youth are represented by this persona. Persona D encompasses youth, young adults, and parents alike. They are generally positive and open to vaccines in general and the HPV vaccine specifically. This persona does not question their doctor about the necessity of the HPV vaccine and consider it to be routine and unexceptional. They trust their doctor and the healthcare field in general. Youth are even less questioning than parents. This persona wants the HPV vaccine to be a part of regular, well child care visits, and they have no need for extensive discussion ahead of time. Some youth in this persona report that they would even get the vaccine against parental wishes if they could. Persona E may know about other vaccines, but has never thought about or perhaps never even heard of the HPV vaccine. This young person is not in charge of their own healthcare decisions and perhaps only sees the doctor for sick or emergency visits. They turn to the internet and social media for information on health concerns. In terms of messaging, this persona prefers to get health-related information from TV or especially the internet, including social media. In order to validate the personas and better understand how closely new participants identified with the personas we developed, we conducted member checking for feedback and reactions to the resulting personas. An invitation to complete the survey was distributed to partners of the Ohio AAP, who then shared the electronic validation survey directly with their contact parents and caregivers and youth young adults. The validation survey had 10 multiple choice questions. It listed each persona along with the associated domains, the knowledge, beliefs, behaviors, and preferences relative to the HPV vaccine. Respondents were asked to indicate which of the descriptions of the personas and the corresponding domains they most identified with, as well as what types of communication they would prefer to receive about the HPV vaccine. 77% of the respondents in the validation survey selected persona D, or the it's all good persona, as most like them. And remember, these are folks that want the HPV vaccine to be routine and an expected part of the vaccination schedule. A distant second of the responses were for persona C, and this was only 16% of the respondents choosing this persona. And remember, persona C is focused on side effects and wants more access to scientific data before making a choice about the HPV vaccine. There were results that were similar to initial data collection. The majority of the respondents in this validation survey reported being very knowledgeable about the HPV vaccine and believed it should be part of routine care. Also similar to the initial study responses, 74% of validation survey respondents felt that it is very important or extremely important to receive the HPV vaccine. I will note that the persona validation survey respondents were fairly homogeneous, and this is in contrast to a greater diversity in the demographics of the sample for the initial pulse interview study. We conducted a second phase of work to interview healthcare providers about the influences, barriers, and patient family responses to the HPV vaccine from their perspective. We also wanted to see what they thought about the personas in terms of their patient family populations. We interviewed 10 primary care providers from across Ohio who had a range of patient populations. You can see the map here of the different locations of the providers. The providers had quite a range of experience providing health care. There were 4 nurse practitioners and 6 general pediatricians. They were all comfortable and confident in discussing the importance of the HPV vaccine, and most suggested ongoing training as important for continued promotion of the HPV vaccine. Even though we just had a sample of 10 primary care providers, we thought it would be interesting to get an idea of prevalence. So their largest or second largest patient family population according to the personas. And here you see those results. You'll see that the majority, similar to our persona results, were in the all positive persona D category. This was followed by persona C, the data driven. These are the patients and families that come with many questions. There's a lot of dispelling of myths that is required. And then you can see the further breakdown for persona B, persona A, and persona E. Here I'll briefly mention the themes that came out of the healthcare provider interviews. Barriers occur at every social ecological level when it comes to the HPV vaccine. There are enormous misconceptions that influence parental reluctance about the HPV vaccine. Provider-patient rapport improves uptake. Providers said the HPV vaccine should be positioned as an anti-cancer vaccine. And finally, tailored messages are needed for broad impact and uptake of the HPV vaccine. I'll briefly mention phase 3 results, which were the handful of parent interviews we started. The main thing that came out of those interviews was really similar to what we found before, but parents by and large said that the HPV vaccine is different than other vaccines for their children, and that a tailored approach is needed, and that providers and other medical organizations can't assume that a one-size-fits-all approach is the right way when it comes to the HPV vaccine. Thanks for your time today, and I appreciate the opportunity to share our project results. Thank you. Hello, everybody.
Didn't want to start that over. Well, big thank you to Dr. Vaughn. She was traveling today, wasn't able to be here in person, but we so much appreciate her sharing our research project that we did with her. Some of it was pre-COVID, some of it was during COVID. So it was kind of a long process with some pauses due to obviously the pandemic. So before we turn it over to Zainab, I did want to see if anybody had any questions or anything additional they would have anything that I wanted to ask about the presentation. Okay, well, with that, I'll turn it over to you, Zainab, for the data presentation.
Thank you, Lori. Do you have the slides on here? Okay, great. So again, today, I'm only going to go over metric 1 and 2. I know some practices are having trouble with metric 3. And I know OSU is trying to get more access to the splicer dicer to get more accurate numbers for that. So for right now, we're going to leave these out of the slides that we're going to present to you. But if you know that you've sent me your data for metric 3, please send me an email and I can create one of these graphs for you for metric 3, just so that you can gauge how your process is going. So for this first figure, I combined all the practices that we have. So the data from everyone that's on this call and the people that are not on here. So that includes Augusta, all the OSU practices, Hilliard Pediatrics, and so on. And here I have data from April and May, as well as the baseline data. And you can see in May overall, we have seen an increase from April, from the month before, and also from baseline. In May, we saw an 11.6% increase from baseline. And from April, we saw a 17.5% increase from baseline, from April. And a t-test was performed. It's still not significant, but with studies like these that are qualitative, usually these values for the t-test and stuff are less considered when looking at the significance of the study. So can we go to the next slide, please? Great. So I combined all of OSU's practices into one figure just so that it's easier to present. We can see here the different colors for each of the practices, and we can see that Grandview has seen a slight decrease, a downward trend since the beginning, since baseline. For Hilliard, we see that in April there was a slight decrease, but then there is also an increase that went over baseline in May. And then for Lewis Center, we also saw a decrease in April, and we saw a slight increase in May. However, it was not over baseline for Lewis Center. So this is, again, just so that you can see how far along you're going, so you can understand whether you need to put more resources into doing something. So this is just for you to understand how your practice is doing overall. So again, please don't feel frustrated or stressed out by these values. Just, keep moving forward, and hopefully these numbers will start to increase towards the end or towards the middle of the study. Can we go to the next slide, please? Okay, and here I have the rest of the practices. I know some of them are not here. That's because we still haven't received May data from a few of you guys. So once we receive that, if you still want to see your graph and before next meeting, please email me and I'll send you that as well. So here we see Hilliard Pediatrics and Blue Ridge Pediatrics both had a slight increase in April, and then it went a little down in May. It's not a significant difference. It's nothing to be worried about. It looks pretty much stable over the past 2 months, as well as baseline. Augusta Pediatrics had a slight decrease in April, but then they went back to baseline in May. So there's still, like I said, these three, Hilliard, Blue Ridge, and Augusta, overall are pretty stable. So there's no really trend, an upward trend or a downward trend there. NCH is doing pretty well. They had an increase both in April and in May compared to baseline. So whatever you're doing, keep doing it. I think we're ready to move forward to metric 2. And again, metric 1 was vaccine completion rates. Okay. And metric 2 is vaccine administration rate. And again, here is one graphic that shows all of the practices combined into one graph. Overall, we are seeing that there has been a slight decrease from April. However, you're still over baseline. Altogether, everyone or together combined, that group is still over baseline in May a t-test was performed here as well to compare May to baseline. And again, that wasn't significant. But that I don't think is anything to worry about.
Zainab, can I ask a question on this slide?
Yes.
And I freely admit I don't know statistics at all.
Yeah, no
But
problem.
it's kind of hard for me to believe that a change from 44% to almost 59% is not significant. Like,
Yes.
how much percentage change do we need to be
I'm not sure,
significant?
because I was also a little bit, I ran the test like 3 or 4 times because I'm like, I felt like it didn't also, it didn't make sense to me that it wasn't significant, but it wasn't. I'm not, when we're looking at the variance within that group, so if we're looking at everybody's May values, and then we're looking at everybody's baseline values, those values are a little similar, and the variance in May is so large that I think that's why it wasn't significant. Because
Okay.
in April
So-
we did see a significant difference, but in May we didn't.
So it's not the absolute average 44 and 58. It's the data that goes into that, maybe how
Yes.
big that range is that makes it not significant. That makes more sense.
Yeah. So what I mean by the variance within the values, so if I'm looking at Augusta's, Hilliard's, all of OSU Practices, I'm looking at all of their May values. There's so much variation there that it kind of drops that down. And I think that's why we're not seeing a significant result here for the t-test. So as we move forward, we can still, I can only perform a t-test comparing 2 values. So I cannot do a t-test comparing baseline and April and May. I can compare baseline to all of the QI months as one, as 2 different values or sets of values. But yeah, like I said, usually qualitative studies like this, t-tests and all these statistical analysis have to be taken with a grain of salt, because these are more likely to show significance with quantitative data that you have lots and lots of points for. So like I said, that's something to keep in mind. Do we have any other questions on the slide? Okay, I think we're ready to move to the next one. And again, we're going to look at the different practices. So you can see here, Grandview had a 114% for May. And the explanation for that is that they had more people come in and get the vaccine than those that were due for a vaccine at that time. Does that make sense? So 7 people came in to get a vaccine, but in May, only 5 people were due for a vaccine, for example. So that was the reason for that over 100%, and that pulled also the May value up. So Kate, Dr. Kirk, when you were asking, you know, why it wasn't significant, well, because one value is 114 and a lot of the values are a lot lower than that. So that value is what pulled that average up. Okay. And then for Hilliard and Lewis Center, we saw, or for Hilliard, we saw an increase in April and a slight decrease in May. And then Lewis Center, we've seen a downward trend since baseline. So Again, if you have questions regarding the data or how the data, or if you feel like you're not collecting the data correctly, please reach out to us and we can help you there. So we're ready for the next slide. Okay, and here again are the rest of the practices. Again, it's missing a few that I haven't received May data for yet. For Hilliard Pediatrics, we can see that there was a great increase in April, and then it went back down to almost baseline in May. And then for Blue Ridge, we're seeing an increase since baseline, but a pretty stable rate for the QI months. So April and May are pretty stable. There's not really much difference there. For Augusta Pediatrics, we saw a slight decrease in May. It wasn't really significant, and then a slight decrease in April and a slight increase in May. Again, these values just depend on how many patients you're seeing that month. So the less patients you see, the more this value will fluctuate because that denominator is so small. So here it looks like it's pretty stable as well. So that's something to keep in mind. NCH saw a slight decrease in April and then a slight increase in May. It's still overall below baseline, but it looks like, it's going up now. So hopefully you can maintain that trend if possible. So these are the slides that I had prepared for today. If anyone has questions, please let me know or just go ahead and ask. And if you want to have a discussion separately, we can also do that as well. So yeah.
Awesome. Thank you, Zainab. And again,
course.
just like she said, if there's any questions, if you go home this weekend, you're sitting outside enjoying the summer and you're like, think about something else, feel free to email us and we'll help walk you guys through some stuff. So now we're going to turn it over to Dr. St. Clair and his team, and they are going to share their PDSA.
Okay, guys, so just a brief reminder for our practice. We're down in Western North Carolina. We've got a pretty large group, cover a large geographic area in a more rural part of our state. And we basically have got all of our doctors and extenders involved in doing this project. So when we looked at our P part of our PDSA, the two big things we looked at was looking at the vaccine status of everyone coming in for a non-acute visit. And the second was having all of our providers use the vaccine sandwich delivery with patients. That was sort of our two main goals. And so in terms of trying to do that, we had a meeting with our nurses to try to implement looking at vaccine status for all non-acute visits. And then we'd also put in pop-ups for all vaccines needed at our coming visits. So that was sort of on the nursing side. We met with them. And then what we did with our providers is we had a lunch with all of our providers. I did a brief PowerPoint that sort of summarized our discussions here to share that with them, sort of the broader parts of what the project is, but then specifically talked about the vaccine sandwich and sort of said, hey, this is going to be our goal as us for providers, is this is how we're going to try to deliver that with all of our patient encounters. The other thing we did was we pulled our data from last year, and it wasn't looking at numerators and denominators, but we pulled how many doses each provider gave total for the whole year of HPV doses, and then comparing it to other docs and other extenders. And we did that just privately. We weren't trying to shame anybody, but we wanted people to get a feel for where they were sitting with other providers. So we also gave that out when we had that provider lunch. So the study part, we had a small increase in metric 1 from 42 to 44%, although the number seems to be the harder one to move. But in metric 2 from April to May, we did go from 37% to 51%. So felt like that was improvement. And I think a lot of that was related to the vaccine sandwich. As we talked to providers, I think they really liked that approach and found that to be really helpful. So what are we hoping to do next? I think the vaccine sandwich seems like that's something everybody is on board with and has found to be helpful. We're going to continue to look at non-acute visits and have them pop up as reminders for people for all of our non-acute visits. But we also already started doing this, pulling individual provider data for April and May. So when we gave them their data, that was from just last year before we started the project, is giving people an update. And really what we did this last time was we compared our actually extenders and our doctors to sort of missed opportunities. And our unfortunately, our doctor group had more missed opportunities than our extenders did. And then encouraged people to look at their own missed opportunities. And so when I went back and looked at my 3 missed opportunities, all 3 of them, I talked with them. They had not taken my advice, but we'd actually talked about it. So I think it was helpful to sort of know that was just, we did everything we were supposed to, and they decided not to do it, which at that point you're sort of, you've done as much as you can do. So anyway, that's sort of what we've done with our PDSA. I hope that was appropriate and good, and happy to answer any questions about what we did.
This is excellent work. I don't know if everybody realizes this is actually 2 completed PDSAs and thoughts on the 3rd PDSA, which they've already started implementing to some degree. And I think that you can see, sometimes things work and sometimes they don't. And fortunately, you had some pretty awesome results in that metric 2. And metric 1 it's much, much harder to move. It's something to keep in mind, but you're going to move metric. I meant metric 1, metric 2. You're going to move metric 2 before you move metric 1, but it's, you have to move metric 2 in order to move metric 1. But I just want to point out, it doesn't have to be complicated. It doesn't have to be big. It shouldn't be big. And you just learn from it. So I think, and you can correct me if I'm wrong, but I think your group actually started using sandwich in the 1st cycle. And that maybe gave you a little information about how to tweak it a little bit to bring it along for the 2nd cycle. And then in the 2nd cycle, you're really seeing significant change. And so then your action is, well, let's continue to do this because this really seems to make a difference. And that's exactly what you want to get out of PDSAs is this feasible? And then does it actually help? And then, okay, let's continue doing this if it helps. So I think this is just an excellent example of seeing the process all the way through to completion and making some decisions about what to do in the future based on what you learned from the test. And again, this counts right now as 2 completed PDSAs. And I think, Lori, correct me if I'm wrong, but I think you need 3 completed PDSAs for MOC credit. So Scott, if your group does this 3rd to completion with looking at the individual HPV data, and then it would be interesting then once you know how each individual person is performing, my guess is that each individual person will actually improve their rates. In this world, we always talk about everybody thinks, including me, thinks you're doing way better than you are. And then when you measure it, you're like, ooh, I'm not as good as I thought I was. I want to fix that. And particularly if you're like, oh, Dr. Joe is doing better than me, I'm going to really step up my game, right? I think that's a really meaningful PDSA. So if you finish that one and, turn in a completed PDSA, you will have met your requirements for MOC.
Yeah, hopefully a little healthy competition is good in there.
That's awesome. Does anybody have any questions for Dr. St. Clair or his team? Well, awesome work. And thank you for taking the time to share that with us.
Of course.
Okay. My least favorite part is to launch these polls, but we do have a poll. Oh, it says no polls created. Oh. Well, I did create 2 polls. Well, I don't know why it's doing that. I created them ahead of time. Well, what we were going to ask in a poll, and we can just open it up for conversation, was about the completion of PDSAs. And have you decided to sort of love the idea, like the idea? Are you going to scrap it? If anybody wants to share what you have done with your previous PDSAs, if you've, and Dr. Crick, feel free to jump in since my polls are just missing.
I'll say you could put it in the chat if you'd feel more comfortable doing that, but just a quick, so I'm trying to remember what love it, like it, or scrap it.
Yeah.
Technically the actions.
I'm going to stop sharing just real quick and see if you guys want to put it in the chat, what you've done, and I might try to go back into the Zoom and see if I can figure out what's going on with that. And we don't have a ton of time, so I'm not going to stress too much, but. Yeah, they're in there. For some reason, it's not. Here, let me just share I'm sorry, you guys. But at least you can see what I put in there, I think. And now my video's gone again. But who cares? It's Friday.
We can see the questions, and it is the first one is what we just asked, and we got a response from Dr. Lucine that says, love the rack cards given out by staff prior to my entering the room. So
awesome. That's so good to hear.
Awesome to get that feedback. Also, just really awesome to hear that that we have provided a resource that you find to be useful. So that's really cool.
Yeah, for sure. Well, we'll quickly go on to our goal discussion. We did have another poll. If I can, find it. Well, I can't now. What was it? I know I just had it up. You guys, I'm so sorry about this. I don't know why nothing's working for me. Okay. So the second poll question was specifically about goal setting, and it's how confident are you that you will reach the goals you've set? Are you super confident, sort of confident, you're feeling doubtful, or goals? What are you even talking about? And we've gotten a couple of goals. See, I was trying to be funny and it didn't even work, so I'm sorry. But we've gotten some goals, and I have shared that with our team, but I know people are still working on those. So I guess we kind of wanted to open up, and actually I'll turn it back over to you, Dr. Crick, because I know you wanted to have more of a conversation. Okay, now I can't share my slide. Hold on one second. Today is just not working for me. Okay.
I just want to make sure that everybody does turn in their goal at some point. Part of QI is setting a goal for yourself, and it's totally okay if you don't make that goal. And in fact, you don't want it to be set so easy that it's a breeze. But to have a goal set before you finish the project is important to sort of work towards something. I know this is a quiet group and you're not necessarily gonna tell me if there are issues, but would it be helpful for us to send an email with a sample goal? It doesn't have to be the exact format, but it includes things like when does the goal end, or like when, the timing, like in what period of time, it's specific, it's measurable. Give me a shout out or something if you want me to send an email with more. Yes, I got a yes. That's good enough.
A yes, please. We'll take it. They're even polite, so we got to do it now.
So we will put together, it's not probably going to be for this specific project, but I'll use a different project, show you a sample goal so that you can translate it into what do you want for, like, you know, which words go where. It doesn't have to be the exact format, but the big thing to keep in mind is what is the number in your goal? What are you going to measure? So which metric? You know, it could be metric 2, right, for example, and then what's your baseline number, which you can look at the your charts, your practice charts for, and then what is going to be your goal by the end of the project, and what is the actual end of the project date. So we'll put that in an email and send that out. Awesome.
Okay. So we just have 1 minute to go, so I will make this quick. Again, this is being recorded, and the slides and the recording will be up on the HPV QI website. So if you have any colleagues or anyone who wasn't able to attend today, you know, feel free to share that with them. And then all of these dates. So the one I did want to mention is, I know I sent you information about the Health Equity and HPV Vaccination, the virtual leadership forum. So that's coming up next week. I think it's on, is that Thursday next week? Yeah, Thursday next week from 9 to 11. So if you're able to attend or want to attend, we do provide CME for that. And we partner with the American Cancer Society here in Ohio to put that on. Again, you have the next data deadline and PDSA cycle, and then our next practice coaching call. So we are done with these full 1 hour kind of learning session combined practice coaching calls. So we will just knock those down to a half hour for the next couple of months. So makes it even quicker, which is kind of nice, but we'll still get information out to you guys. The same for August. We actually only have one PDSA left to turn into us. That doesn't mean you have to stop doing your PDSAs. You're more than welcome to send them to us after the fact, but you'll do a data pool in August, one more in September, and then that final sustainability data pool in December. And of course, we'll send reminders about all of that. But that is all we had for today. Thank you so much for being on. I know Friday afternoons can always be tough, but so we appreciate you guys making the time and spending it with us. So thanks so much, and feel have a great weekend, and email us if you guys need anything or have any questions, and we'll work on getting all of this uploaded and sending the email with the kind of sample goals. And that's it. Thank you guys so much.
Thank you.